things that are too good to be true.
Tell me why you're so emotional.
I said a month ago. He doesn't wear oxygen at all.
This is your life. This is the life of your wife or your husband, your sons, your daughters, your family members.
What does your wife think of the new you?
We go on so many dates, I don't know where to start. I'm just a teenager.
It is so exciting what's going on. You know, the fact that you could literally take your own stem cells and bank them and have them available.
This could benefit me, my family, and just think of the larger implications of actually helping all of the, the people that I've served with, and I see that, they're in just as much pain.
Neurological conditions, things like Parkinson's, MS, ALS, traumatic brain injury, autoimmune diseases, diabetes, lung, heart, kidney, essentially any organ or tissue inside your body that needs to have healing can be used with these cells.
You know, it's not the fountain of youth, but maybe it's some droplets from the fountain of youth. You're putting these cells in that actually regrow tissue.
I played 16 years, 100 or more games a year. Since then, I've been able to speak to a lot of people, not just athletes, who have gone through this process and have had raving reviews about it.
I know the research that's going on right now, in a year, will just blow away what we're talking about today.
Can you imagine if we can not just take care of injuries and diseases, but actually even prolong healthy, functional lives?
This is revolutionizing medicine as we know it.
So we need to look at cost here. We need to talk a little bit about money. So knee replacement typically is $46,000 to $76,000 if it's not complicated. Out of pocket, if you got insurance, $4,000 to $15,000 depending upon your deductible. Right? So it's not cheap. Amniotic allograft injections are between $4,000 and $8,000 per injection nationally, not covered by insurance. All right. So are there other things that are not covered by insurance? We specialize in medical weight loss at our clinic. Medical weight loss is not covered. Now, what is covered with weight loss? Bariatric surgery. Making your stomach the size of a tennis ball, right? That's covered by insurance, right? But to actually teach people a new way of lifestyle, it's not covered for medical weight loss. Another example, there are clinics that are doing partial knee replacements. Have you heard of that? Just half the knee gets replaced. In the other half, in the other half, they're because that's the really damaged part.
Okay.
Yeah. And so the other side is not quite as damaged. And you know what they're doing? They're injecting stem cells into that other part that's not replaced, but the insurance covers the knee replacement part, but not the stem cell part, right? That's out of pocket. Yeah. So there's many different things that are not covered out there. Wellness is generally not covered well by insurance. And this is the fact, and that amniotic allograft isn't either. So if you're going to do this, this is an investment that you have to make in yourself. So what is amniotic allograft regenerative therapy? What are stem cells? They're basic building blocks of the body. Every other stem cell, every other cell in the body stems from a stem cell. That's why we call it stem cells, right? And they have the ability to differentiate into other tissue, depending on the messaging signals that they're getting from the body. So these messaging signals work with inflammation. So if you're going to work with us, don't get a cortisone injection in 30 days before you're going to work with us, because we're not going to accept you as a patient until after 30 days has gone by, because we want some inflammation in there, right? That's how the stem cells know how to work. So when we cut ourselves, stem cells are just waiting by our blood vessel walls, and they're activated by the inflammatory mechanisms. And they go in and they start healing, and they differentiate into muscles and tendons and ligaments and other tissues and nerves. And they can also differentiate into new stem cells. They can actually make more of themselves. We're going to talk about that in a second. So here's a stem cell. It can do many different things depending on the messaging signals it gets. And it can convert into new stem cells. So we get amniotic allograft from planned C-sections. There are no embryos involved. In fact, in America today, there's no embryos involved. We would never do it. It's not ethical. But it's not really even happening in America today. But it comes from placenta, from planned C-sections that would have normally been discarded. But women, healthy women, are donating this material so that we can use it to help regenerate our own tissues. It's donated by healthy moms at live birth C-sections. They're processed in a clean room, and they are highest standards, the same standards as tissue transplants, organ transplants, cornea transplants. It's that type of standard that's followed. And they're subject to the very stringent United States pharmacopoeia testing. So here's the importance of an amniotic allograft. When a newborn baby comes into the world, 1 in every 10,000 cells is a stem cell. When we get to be about 50 years old, 1 in every 400,000 cells is a stem cell. When we get to be about 70 years old, 1 in every 2 million cells is a stem cell. That's why little kids can regenerate so fast. They got more stem cells, right? So we've got different procedures that are available out there. You can go to a medical doctor and you can get a bone graft. They pound this spike into your hip bone and they suck out bone marrow. And they spin down the bone marrow and draw out the stem cells. And they inject it into the damaged joints. And it works. Well, that's part of the problem. You think that hurts? You have that spike thrown in? Yeah. Is there a chance of infection? Yeah. But does the process actually work? Yes, it does actually work. But now, if I would have done that, I would have been injecting 67-year-old stem cells into my own body. I prefer having the 9-month-old stem cells. I've got more regenerative capacity. You can take umbilical cord blood and inject it into joints. It's got some growth factors, but it doesn't have stem cells that regenerate into joints and cartilage and tissue and things like that. That cord blood
Sorry, the umbilical cord does not?
No. It makes new blood cells and has growth factors in it. But they don't have mesenchymal stem cells. And we need mesenchymal stem cells that can differentiate into cartilage, tendons,
Right.
muscle, nerves, all of
When
those.
they're injected to the certain area, they just know what they're going to derive.
They're getting messaging cells from our immune system that says, here's what you do. Go to work, guys. Okay. But umbilical cord doesn't have those specific types of cells. Now, does it have some benefit? Yes, but not the same as amniotic.
Okay, and that's only from placenta, is what you're saying?
Well, we're going to get into that in just a second here. I want to differentiate this for you. So the actions of amniotic allograft in regenerative medicine is it goes in and actually begins to break down scar tissue. So in this shoulder, do you think you have some scar tissue in there? Yeah. You bet. I'll tell you, after the first couple of weeks after my injections, I was walking around like Orville Redenbacher popcorn. I was cracking and popping so much. And every time it would do it, it felt better. Because what was the body doing? The amniotic allograft was breaking up old adhesions and scar tissue from all the injuries and from the surgeries that I had. It goes in and it's antimicrobial. It kills microorganisms. It's anti-inflammatory. It reduces inflammation. It's regenerative, meaning it replaces damaged tissue for up to a year. Some people say 6 months. Some people say 3 years. The main consensus is up to a year. Let me be clear on this. I'm going to read this because I don't want to get in trouble with the FDA. Because we cannot test the amniotic tissue for stem cells without killing the stem cells in the process, we cannot claim there are live stem cells in amniotic allograft. The FDA has deemed this a rule. The company that we work with tests 4 random samples from every placenta they collect. After amniotic allograft has been processed, they are cryofrozen to minus 80 degrees centigrade. That's how we get them in our clinic. When the amniotic allografts are then warmed, they find 92% of the stem cells are viable, alive, and can then go to work. However, because the sample that goes in the patients cannot be tested without killing the stem cells, we cannot claim 92% viability rate. All we can do is show you what happens to patients that have been injected with amniotic allografts. Amniotic allograft simply helps the body repair and regenerate damaged tissue.
My name is Barb. I was very happy to be in touch with this practice when I discovered I had a torn meniscus in my left knee. And I was, in my mind, I was thinking, oh, I'm following all my friends into surgery on this knee replacement surgery. I then learned while I was here that there were other options, and I read certain things like PRP, or my friends talked about shots that they were getting. Well, that's just cortisone shots. And I'd also read that can make arthritis, which I do have in my body, much worse. This sounded better. So that's what I decided I would try before I even thought about any of these other options. I had an event in my left knee that I found later through an MRI that I had a torn meniscus. Certainly the physical therapy that I did afterwards helped a lot. But what really, but actually my right knee was hurting too. And on an X-ray, I could see that the two knees appeared very similar. And then I had something else happen. I had cellulitis in the right hand. And that was frightening. And I took therapy, some sulfa antibiotics to bring that down, but it left my right hand very gnarled, and the bones were swollen and raised, and I wondered if I'd ever play piano again. So, first of all, I was very apprehensive, of course, but first of all, I tried this amnioallograft in the left knee. And after 2 weeks, it seemed that, well, things seem to be doing just fine. I'm totally out of pain and everything. And so I went ahead and had 2 more injections, one to the right knee, and the other was divided in various joints of my right hand. And today, about 2 months after, I can say that my right hand is almost straight as my left hand, and I'm totally pain-free, and I'm told this process should be good for another 6 months to a year, some say even 3 years. So I'm very encouraged, and I'm hoping I have totally bypassed any kind of invasive surgery for these conditions. I tend to be very allergic, and I thought, oh, is there any chance I could have an allergic reaction? But I'm happy to say I did not. My left knee, left leg is almost, not 100%, but 99% to 99.5% as mobile as my right leg. I would definitely
So Barbara had, as I identified on MRI, broad-based tear of the meniscus. And it's completely resolved. So that's the wonder of this type of procedure. Oh. Your wife is going to miss the part she was.
Oh, really?
Yeah. So let me turn this down a little bit. You'll have to explain it to her. So amniotic allograft, stem cells and tissue building blocks. So there's growth factors, proteins, collagen, hyaluronic acid, and stem cells in the allograft. When injected into an injured area, the theory is the amniotic allograft stimulates repair and your body regenerates only what's needed. So it regenerates only the tissue that's actually needed. There's never been any sign of rejection or infection associated with this. Yeah?